नमस्कार, सत श्री अकाल, आदाब, good morning, good afternoon and good evening जहां से भी आप हमें सुन रहे हैं. Thank you for joining our live session. My name is Kunjan Mawar. हमें आपके host और दोस्त for today's FP live session. Indian origin folks living in US, if parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobalDoctors has your back. Access to doctors from USA and India. Specialties includes internal medicine, cardiology, orthopedics, oncology, pediatrician, and many more. Prescription will be provided. Response time is 1 to 3 days. Family members can participate live via video physician consultation from any part of the world. Video consultation is up to 30 minutes. In-app messaging with doctor after consultation, ID, and portable health passports. Today's FB live session, we will be exploring and providing more information about autism with Dr. Sangeeta Elhans. Dr. Sangeeta is a board certified general pediatrician with 26 years of experience. Her area of interest and expertise is early diagnosis of autism. She did her medical from All India Institute of Medical Science, aka AIMS, and did her pediatric training at Mass General Hospital in Boston. Welcome to eGlobal Facebook Live session. Thank you for taking time out from your busy schedule and educating us on autism. How are you doing this evening?
Sure. Thank you. Thank you, Kunjan. Thank you for the introduction. Do you want to ask questions? Do you want me to start?
Yes, I'll ask questions. So how are you doing this evening?
I'm doing well, thank you. This topic is near and dear to me. I'm very passionate about it, especially with the early diagnosis, because I feel there's a big need in our community, not only in the United States, but all over the world. And I think we can make a big difference if we could do that. So I'm hoping that the message goes out not only to the community, but to other physicians, so that we can help a lot of kids.
Okay, so what do you say with that? We shall dive into today's session. So first of all, for people like me who doesn't understand too many medical terms, what is autism?
So autism is, it's interesting. It's becomes more common now that in pop culture and in day-to-day life, people use the term very loosely. So autism actually is not a disease. It's more of a neurobehavioral or a neurodevelopmental disorder, which basically means neuro means, based on your neurological system. So it's a brain-based disorder, and it's developmental because the way it presents is it presents with atypical development in the child in the early childhood, or with behavioral changes. So you can call it neurobehavioral or neurodevelopmental. And, we really don't know what causes it, but it does manifest itself in various behavioral and atypical development in the child. So, you can call autism is essentially a social disability, social connection disability. Like you have learning disability, you have hearing disability, visual disability. This is a social disability. So because of this disability, people have a hard time connecting with each other. So, as far as we human beings have been on this planet, we have all been social human beings. And the way we connect is based, with other people is through language, through nonverbal means. Our survival depends on our connection with fellow human beings. That's why in the last 2 years in the pandemic, when people were in lockdown or they were at home, there was an increase in, depression and isolation. And, this was not a normal state for us because we are used to being with people. But these kids, when for some reason, we don't know why, these kids have a hard time connecting with other people. So you can imagine the kind of deficits, the kind of issues these kids will have. And most of these kids, have symptoms in the first 3 years of life. But the sad part is a lot of them are missed because, people think, they will outgrow this. They're just different. They're talking late. And, even in the United States, when there's so much research on autism, the average age of diagnosis is 4.5 years. And, you've missed out that crucial time, because for a child, the maximum brain development happens in the first 3 years. So if you can diagnose it in the first 3 years, you can make a big difference in this child's life, not only with social connections, but that's how we learn in school. If we don't understand what the teacher is saying and we don't do what the teacher is saying, how are you going to learn? You're not able to make friends. So if you're not making friends, then you feel isolated on the playground, which increases your chances of getting bullied. You feel, you develop social anxiety, depression. So, a lot of these kids, as they get older, will have a lot of psychological problems. As an adult, a lot of them feel isolated, and even if they may be very bright, they may be underemployed because they just don't, even at workplace, as social connections are so important, how you relate to people, how you sit in a group meeting. So it's important that we pick it up early, because studies have shown that if you pick it up early, you can teach the kid these skills which they haven't learned. Just like a kid who has learning disability, you can teach them how to learn in a different way. Similarly, you can teach them. So that's my goal. Try to pick it up, because we have tools now. We have tools, we have ways of finding it out. But I think that it needs a lot of awareness. Parents need to be aware, physicians need to be aware, grandparents, family, friends, teachers, daycare teachers, everybody needs to be aware of this.
Hopefully they will get some more awareness from our sessions today. So thank you so much for shedding some light on what is autism. So with that, I want to ask, what causes autism?
So I wish we had an answer. Of course, this is a relatively new revelation for us. It's not that we haven't had autism. There were probably people, hundreds of years ago who had autism, who were, they were never labeled. Maybe they were labeled as, loners or quirky people. It's in the 1943 when Leo Kanner, he was a scientist, who's a physician, who first described autism in a group of boys. And it's only in the 80s that the diagnosis came into our DSM, or the diagnosis and statistical manual that we have. So we do know a few things. We do know that about 20% of kids may have some type of genetic tendency towards it, because we can now find some genetic sequences, some mutations. Also, we do find that twins, like if they are identical twins, they have a very high likelihood that both the twins are going to have autism. So there is some genetic component to it. Siblings, like if you have one child with autism, there's a 20% risk that the other child will have autism. So we know that genetics plays a role, but that's only about, as far as we know, only about 20%. Environment probably makes, there are so many chronic illnesses, so many other things which are blamed on environment. We don't know why cancer is increasing, hypertension, heart disease, all of these things are increasing. Similarly, there probably is something in the environment which we are not aware of, whether it's some toxins, some mother is exposed to, infections during pregnancy, we don't know, because there seems to be, like if the mother had fever during pregnancy, there seems to be a higher risk of them having a child with autism. Again, very minuscule. It's not like every mom will have that. Gestational diabetes, twin pregnancy, maternal obesity, all these high paternal age, that we find that, the father is of an older age, maybe some mutation happens in his genes. So we know this. And there are, of course, certain neurological diseases which also can present with autism.
Okay.
But yes.
So in the beginning.
Yes, we in essence we still don't know.
We don't know yet. Yeah. So it's too much of unknown maybe territory for now, and hopefully we have medical sciences, they are advancing at a greater speed. So hopefully in coming years, we should know more about it. So in the beginning, when you were describing what is autism, you said that even in US, a child can be diagnosed as early as 4.5 years of age, but we miss the crucial age. So what are some possible signs, like if people are listening to us right now, so what are the signs that they can catch it, that these are so what are some possible signs of autism?
Yes. So as I said, autism is a disorder of social connection. So, if most kids, most parents get worried about the kid when they're not talking. And this usually happens around 18 months to 2 years. But if you look back at a lot of the videos, and if ask the family, especially if they have another child with it, they will tell you that this kid, even when they were very little, like, if you remember, if your parents, like a 2-month-old baby, when they coo, we go and coo with them. And we kind of match their, and it's a back and forth conversation you have, even though the baby is not talking, but you will see the facial expression, the baby's eyebrows go up, their mouth pouts, then they coo back. So this is called back and forth communication. So it starts that early. And a lot of parents will tell you that, we didn't see that in this child. That kid would smile, we would smile at us, but we didn't have that much of the back and forth. So the other thing that a lot of parents will complain at, when the child is 1 year old, they may not point at things, they may not respond to their name. Normally, kids are not talking, they may just say mama, dada at that age. But if you ask them to look at something, they will look at that, but they will not do that. They will not follow your eyes. The most common thing that parents notice is that the kid doesn't have eye contact. That's how we connect with people, is through eye contact. So these kids, even if they have eye contact, is maybe very brief, but they're too busy doing their own thing. They're kind of in their own world. And if they need something, they will make sure they get it. They will either drag the parent's hand and take them to the pantry if they want cookies. But if the mother asks them to get something, can you go and, bring me a cup of water? They'll not do it. But the most common thing that parents notice is that they're not talking. So that usually happens around 18 months or 2 years. And even if they're talking, a lot of these kids will be talking. They know all the alphabets, their numbers, they can recite nursery rhymes, but they can't have a back and forth conversation. And that's what makes us human, is, a back and forth, to and fro communication.